Okay, good afternoon, everyone. It is an absolute pleasure to be here. What an extraordinary conference on incredibly important and challenging issues. And so I'd like to thank HHS and the hosts for bringing this together. Our panel this afternoon called Staying in the Lines While Out of Bounds is going to explore some of the privacy and security challenges in the world beyond HIPAA. And we have an extraordinary panel today to address those issues. Immediately to my left, we have Chris Bradley, the CEO of non-HIPAA, that has Mana Cloud and creates APIs for digital health records. To his left is Cora Hahn. Cora, I believe, spoke earlier today with the Federal Trade Commission, a true expert on healthcare enforcement and policy issues at the Federal Trade Commission, where she worked on the rules related to high tech, as well as enforcement and pulling together policy development. Then we have Erin Mackay, who is a patient advocate and focuses on making sure that patients have access to their electronic health records. And then rounding out our panel is Jules Polonetsky, the president and CEO of the Future of Privacy Forum, a nonprofit that works with industry seeking to develop best practices around information, data use, and privacy. So what a extraordinary group. So let's get right into it. We've heard a lot about HIPAA, obviously, but that applies to hospitals, health providers, and covered entities. But there's an entire world out there of entities that aren't covered by HIPAA. So in that context, what are the rules? What should the rules be? And I'll start with Cora from the FTC.
So thanks for having me. I'm going to start this conversation off by talking about what some of the lines are when you're out of bounds, when you're outside of the HIPAA area. So our primary enforcement statute at the FTC is the FTC Act, which broadly prohibits unfair or deceptive acts or practices in or affecting commerce. Our FTC Act jurisdiction is fairly broad and actually covers both HIPAA-covered and non-HIPAA covered entities. Although there are some carve-outs that I alluded to earlier today, including, for example, most types of nonprofits. But we're going to focus today, I know, on the out-of-bounds area. So those entities that are not covered by one of under HIPAA. So there are two types of actions that we can bring under Section 5. The first is one for deception, which is a material representation or omission which is likely to mislead consumers acting reasonably under the circumstances. So just to give an example, if a mobile app developer says to a consumer, we will not share your information with advertisers, and then it does, that gives rise to a deceptive action for us under Section 5. So I want to note here that so that these types of representations to consumers, a company can make these not just in a privacy policy, which I know there's a lot of discussion over who reads privacy policies, but also in many other ways. So we have brought cases at the FTC based on misrepresentations from a user interface and also from privacy settings. And so it's important to keep in mind when you're thinking about what sorts of statements a company can make to consumers that it can happen outside of privacy policies and terms of services and documents like that. The second type of action we can bring is one for unfairness. So even in the absence of a deceptive statement, we can bring a cause of action if an act or practice causes or is likely to cause harm to consumers that is not reasonably avoidable and that is not outweighed by countervailing benefits. And so what this means is, and we have used the unfairness prong to bring actions, for example, against companies that fail to have reasonable data security practices. And I'll mention just one that my colleague, Laura Vandroff, mentioned earlier today. She mentioned the GMR case, which was a case involving the failure, among other things, to provide reasonable oversight over service providers. And in that case, we alleged both unfairness and deception because the company had also alleged that materials going through their transcription services would in fact be secure when they were not. So, so that's just one example of how we have applied Section 5 to the area of consumer health information.
Before I move on from you, you talked about deception. You talked about a material misrepresentation, and you also mentioned a material omission. So silence, in some ways, can be deceptive as well. Could you just dig into that for just a minute?
Sure. So exactly as you said, there may be cases, for example, in our settlement with Facebook involving a material omission. And so what happened in that settlement was the company noted to people when they put everyone through an update of their privacy settings. They said to people, oh, we are giving you more control over your privacy. I don't know if any of you guys remember this. This was back in 2009, I think. And in fact, that was true. They gave their users additional controls. But what they failed to tell users was that they were also making certain elements of their personal profile information public to everyone. And that included your name, that included your profile picture, it included your friends list for a brief period of time. And that is an example of a material omission.
So I'd like to turn to the consumer perspective. And so, Erin, I'm going to turn to you. What do consumers believe the rules are? Or what do they believe the rules should be when they're dealing with a non-HIPAA covered entity like an app or device that they purchase?
Thank you. Well, so as we begin to liberate data and it becomes more interoperable and we're sharing from EHR to EHR and increasingly sharing with patients and families themselves, 3 cheers for OCR's guidance and their seedling to nurture to get that HIPAA right of access out there. That's a huge win for consumers across the country. But we need to equip consumers with the information to understand what they can do with that data once they get it. So if they download it from a patient portal or if they obtain structured data in another way, we need to make sure that they understand where they may be able to securely store, analyze, and otherwise use that data. You asked about what consumers think the rules should be. I don't think that most consumers track the technical or legal distinctions among different entities or developers when they're managing their healthcare or when health data is moving from one setting of care to another. But we do know that almost 9 in 10 patients nationally think that it's important to understand how their information is being collected and used. And we're definitely not doing a great job right now explaining to them in privacy practices, for example, the uses of that data. So I think we need to do a better job equipping consumers with information that is accessible and understandable about how their data is going to be used. I think there are a couple of different issues there. Consumers want to understand any circumstances under which their identifiable health information is being disclosed without their explicit consent, and within that, I think it's important to distinguish whether disclosures of any kind are made without consumers' explicit consent or authorization, and then also whether that data is identifiable. So just a couple of
Let me follow up on one comment you made and push you on this. So you said that consumers really aren't focusing on legal distinctions or technical distinctions as to whether an entity is covered by HIPAA or not. So does that suggest to you that perhaps there's a gap that needs to be filled or similar rules need to apply because a consumer doesn't understand?
Yes, I don't know that it's accurate to say they're not focusing on it. I think it's, that they just aren't aware that when their health data moves from outside the bounds of a HIPAA-covered entity, again, if they download it from their patient portal, from their doctor, who is a HIPAA-covered entity, into an app that may or may not be offered by their doctor and therefore, has the same protections. I just don't, it's a lot to keep track of. I do think that there is a gap. I don't know if it's a gap so much in policy as it is in understanding, however, and education, which the previous panel mentioned.
So in the context of devices or apps, oftentimes they are available to consumers for free or very low cost. And in some ways, the exchange or trade-off is the use of the data, right? The use of the data collected by the app, the use of the data collected by the device. Do we think there are legitimate or illegitimate uses for the data or proper ways to monetize that information, not proper? What are the rules of the road there? And I'm going to start with you, Jules, because FBF has a really large number of members who are in this space, and you're often at the forefront of thinking on this. So what should the rules of the road be? And legitimate, non-legitimate uses for information from these health-related apps?
The challenge that I see is that, in so many areas we have this black and white world. It's banking data, it's protected in such a way, well, otherwise anything else goes. it's HIPAA data, it's protected in such a way, and if not, well, it's just what I've searched or what I entered in on the web, in which case I better not be deceptive, I better not be unfair, but anything goes. And the reality is probably somewhere in between. The wearables area is probably the area where we can start seeing standards that are starting to be developed. The leading app stores said, maybe not a really good idea if everything you do while wearing a wearable is immediately sold to a data broker or is used maybe to tailor ads around the web. So we're not going to allow that. Well, that's interesting. They sort of set a standard there that obviously anybody who wants to get their app downloaded through the leading app stores needs to play. But other than that guideline, you still have this wide range of practices. And so here you've got companies coming into the space, and they want to be good actors. I want your health record. And many of them mean well. They're motivated to do the right thing. But they say things like, I follow HIPAA, because that's what they think they should say, right? And, well, Cora might say, but you're not actually regulated by HIPAA. I get what you mean, which is like, well, things that aren't allowed there I probably don't do, except maybe I do some things. Well, maybe now I have a legal problem, right? Or they say things like, I can update my policy at any time, so check back here often, which is what companies say, but probably what you shouldn't be saying if you have sensitive health information that maybe isn't HIPAA regulated, but people would be surprised, right? But that's typical. Or maybe they say, well, I'll do nothing. I'm going to respect your data. I won't share it. I won't do anything. However, if I'm acquired, of course, then my successor will have the data. Now, the reality is the FTC would step in because there are legal standards that would prevent it. It's sensitive data. You can't just go use it in a way that doesn't live up to what you made without perhaps getting some real new specific permission. And so what we frankly need is, I don't want to call it HIPAA light because maybe it doesn't look like HIPAA, but it's certainly not general marketing practice, and it probably needs some stages, right? Perhaps maybe my pedometer information, well, I don't know, you want to give me, I get awards today, hey, you got a personal best, now here's some discount from some sports retailer. Okay, but they're tracking, well, I ran further than I did before, okay, maybe that's fine, but obviously there are plenty of other types of data. Here's how your heartbeat has been changing, over 35 days and your blood pressure and so forth. Well, maybe I ought not to be getting, targeted advertising based on that.
Push you on moving off our script on just one statement you made where you said, well, what we need is some rules. And so I guess I come back to you and say, what is it that we need? Do we need self-regulatory guidelines? Do we need industry to step up to the plate? Do we need a regulatory or legislative fix? What is it that you think we need where HIPAA is not at play?
I think we need self-regulatory guidelines. Whether some of those end up settling into a legislative model once you start seeing what works and what doesn't work, perhaps. But the first step usually is, what are the good folks, what are the companies that are thinking about this carefully doing today? Can we take those policies and baseline them? Can we get people to commit to them? In the world of student data, we have 260 companies that signed on to a pledge. People were getting worried about what are all these vendors that today are providing technology in schools. They've got what your kid clicked on and what he's learning and what she's eating. What do we do? How do we make sure? So we gathered up what initially 10 or 15, but almost 260 have signed on. And they've said things just very clearly in a hopefully legalistic way. We're not going to sell you kids' data. We're not going to use it for behavioral advertising. If we update our policy, we're going to get new permission. I mean, things that are not incredibly complicated. You don't need an elaborate rule behind it, but actually getting them on the hook so that the FTC could enforce it. So it's actually law now, right? They've made a clear statement. Boom. I mean, we talk about self-regulation sometimes. We talk about it like it's a voluntary sort of thing, and it's true. You don't need to sign on to it. But once you do, you've sort of de facto created national law. So I think that's what we need sooner than later.
So let's turn to, so Chris is the president and CEO of non-HIPAA. You are actually in this space, right. Building out APIs for consumers, for patient data. What are your thoughts on this where, first of all, are your products in the HIPAA space? And if not, what are the rules?
Yeah, absolutely. So what I was going to say is, from our perspective, what we do is we actually work to get the data out of the clinical systems and we combine it with some of the traditional non-clinical data. So device data, patient-generated data that is either manually entered or from an app. So from my perspective, we're actually helping get very much PHI and HIPAA related data into applications that, that then are going to use it. So from our perspective, HIPAA is now flowing into apps that traditionally haven't seen that kind of data. And one of the things that I think is really important when you mention monetization is, we keep thinking of, monetizing the data as separate from patient care or the use of the data in the care context. But I think the opposite is true. What we really need to figure out is, why is everyone trying to monetize this not directly related to patient care? So in an ideal world, the way you monetize this data is you help people get better, and everything is aligned to using that data to improve care. And that there's no other way to use that data that's not in some way that.
Well, what about a tremendous revenue driver for entities is selling the data for marketing, or selling it to a data broker, or for advertising? So are you suggesting that shouldn't be part of the equation? It's not related to the healthcare?
Yeah, I would say, if we figure this out, and I don't think anyone has figured it out, but in other industries, in order to create an interoperable infrastructure, there's been a way to monetize the data, to get value from the data that feeds back into creating more infrastructure. And I think we need to figure that out in healthcare, where by sharing the data, having the data, getting the data all in one format, making it interoperable, you're directly benefiting the patients. And so the companies that need to survive to actually implement that infrastructure, so not just FHIR as a standard, but if we implement FHIR nationally, there's going to be a price to that. To create that type of infrastructure, to monetize it, to fund it, we need to figure out how to monetize it that doesn't include marketing and things that don't relate to care.
In the world of mobile apps and devices, where it involves obviously or potentially very sensitive health information, there's a lot to explain to consumers when they download the app or purchase the device about what data is collected, how will they access it, what will the uses be, how long will it be retained and stored. How are you addressing those challenges? And then what are other ways to be more transparent and to engage consumers as they move down this path with these kinds of devices?
Yeah, so I mean, from our perspective, we're really excited about FHIR and how that's now starting to become part of the national dialogue. But getting the data out is only the first step. Once you have it out, now all of these different questions become much more relevant because it's easier to get access to the data. So from our perspective, one of the biggest things is transparency. So where did this data come from? Who's using it? How are they using it? And the infrastructure to give that transparency should also give you control. So as a patient, you should see who's using it, where it's going, and you should be able to choose who's seeing it and what they're doing with it. So you'll be able to switch it on.
So let's go from the theoretical or principles that you just articulated to reality, your products. Transparency is critical, we all agree. How do you actually make that work on a mobile device? Or on the computer or however else?
So, imagine logging into your unified patient portal where you go in, and we don't call it, let's not call it a patient portal, but effectively it's, in our lingo, a patient portal. You go in, you can see all of your information. So then this is literally how we do it. It's coming from 15 different hospitals. You have 20 devices that you've connected to your portal. And now you have a separate place or page where you can see a list of providers or a list of hospitals or a list of apps, similar to how the large unnamed company does it with their app or their program. And now you can switch on and off who's seeing it and what they're doing with it. So just go down the list, say, oh, this physician, I want to share it with them, or this app that's using it, I want to stop having them get access to my data, or I only want to give them access to, let's say, my lab results. Regardless of what hospital it came from or where the origin is, that's on the ground what it would look like.
And do they have the right to delete data as well?
So that's trickier, right? So we get that question a lot: is how do you then have feedback back into the medical record system, or in this case, delete it from the medical record? They can delete or alter it on our system however they want. But the moment you're starting to alter the record of truth that's being used for clinical,
I'm talking about your product.
Yeah, absolutely. Yeah, you can edit it.
But Mark, what I like about the way he's talking about privacy is that the privacy stuff, which might be boring or not interesting to a patient, these are features. People who are looking at this probably don't think about it as privacy options. It's, this is the point of it, and this is user design. This is designing for it to communicate in an appropriate way. And I think that's sort of what we failed at in the general marketing world, because we may not want you to be flipping on the switches. Here, if we're able to align the uses with a feature, and we say to designers, we want people to be able to use our product in a way that shares, doesn't share, allows, doesn't share, I think we have a shot at actually succeeding better than long legalistic policies.
So Cora, looking at it from an FTC perspective, your FTC is concerned about representations, about clear and conspicuous disclosures of material terms. You've published .com disclosures on how to make those kinds of disclosures in an online or mobile environment. What are your thoughts about how companies where HIPAA is not at play should be making disclosures and be transparent to consumers?
Yeah, so we hear a lot that it's a very challenging issue, how to provide effective disclosures and obtain informed consent when you're thinking about a screen that is very small, or when you're thinking about devices where people don't even have a screen. But there is a lot of, I think, excellent work being done, and in our Internet of Things report, we have a section about how companies have been innovating how they communicate with consumers. So, you know, some of the ways, there are dashboards as we've been talking about, but in addition, some of the things that we mention in the Internet of Things report are things like, think about perhaps offering a way for consumers to have brief bits of information, and then if they need more information, be able to delve down more deeply into particular practices that might govern. Think about out-of-band communications. So think about alternative ways of reaching your consumers if there are updates that you want to provide. And so there are a number of mechanisms, I think, that companies can start to begin to use in order to make effective disclosures. Because I think, and this circles back to the previous question, context is very important. We've heard over and over again from consumers about how and where they feel comfortable sharing their information. So there definitely are contexts where consumers are comfortable sharing their information, even very sensitive health information, if it is, for example, to improve care. It's when there is sharing that they don't reasonably expect to happen, when it might be, for example, the data broker situation, where I think consumers get very uncomfortable.
That sets me up perfectly, because I was going to say, you know, I think it's important to keep in mind that every consumer is going to have a different comfort threshold in terms of, you know, how they are comfortable with their data being shared and used and even sold. There are some, you know, individuals, patients, family caregivers whose desire to accelerate research and whose need for cures is emergent and very specific, and they are willing to share their data in the hopes that it's going to contribute to medical research and accelerate cures that are going to benefit themselves or their families. And so they might be willing to have some of their data used for marketing or advertising, and be willing to, you know, put up with the ads that are on the, you know, the app or the PHR that they're using. There are some consumers who are even willing to have their data sold. At a consumer panel at Datapalooza yesterday, moderated by Casey, who's here in the crowd, she made the point that she made the point that I hadn't really thought about before, that, you know, in her opinion, it's not that she's uncomfortable with, and please, Casey, correct me, I know you will if I'm wrong, that patients are, or that her data is being sold. What drives her nuts is that she's not getting cut in on those profits, exactly. So it's, you know, just to keep in mind that every consumer is going to have a different comfort threshold, and that underscores the transparency point, and that we just need to do a better job informing consumers about the ways in which their data is being used. And to that point, I just wanted to lift up ONC's model privacy notice, which is recently, or is undergoing updating. It was originally developed for PHRs. Obviously, our digital landscape has shifted a little bit away from PHRs and more to apps. And the idea there is that it's a soup can label approach, or a nutrition approach. They're not mandating what the practices, the data sharing practices, the portability, the sale practices are, but just mandating the display of that information, so it makes it easy for consumers to compare practices across apps and then make the choice that best meets their needs.
So I want to, if you'll think about questions, I want to turn to the audience, but I want to push back or dig deeper on that, what you just said about that. So I follow the nutrition label concept. I'm curious, from your perspective as a patient advocate or others on the panel, are there some practices that just shouldn't be happening, and it shouldn't be a matter of, well, you can choose to do it or not, but the use of this type of data for this purpose is so sensitive or inconsistent with some general concept or notions that you know, we don't have HIPAA here, but you shouldn't do this regardless?
I think the baseline for me is that individuals should never be surprised by how their data is being used. And again, I can't speak to every individual's personal comfort level, so that's where I think I'll stop. They should never be surprised by how their data is
I'll
being
note
used.
though, again, the app platforms at least have said, you know what, sharing data even with permission with information resellers, I think that's their nice way of saying data broker, may not be permissible, period, under these, nor may you share this data for behavioral advertising type use, right? So they've sort of said, you know what, here's where we propose drawing a line. Now, again, that's only for apps, so if it's not an app coming through the App Store, I'd argue very similar rules might apply. Now, that doesn't mean that there aren't other ways that you can opt in to share it for research and so forth, but it's sometimes reasonable, frankly, to just take some things off the table because of the concern about whether or not this will be manageable for users. The other quick point that I want to put on the table, Mark, you mentioned de-identification. Huge challenge and opportunity here, right? We've lived with HIPAA definitions of de-identification. People have debated, outside this room, whether it works, it's right, it's better, and so forth. What do you do outside this world? Right now, you've got an industry definition of de-identification that sometimes means I don't have your name, but I've got a cookie, I've got a lot of data about you, but I don't know your name, but I can actually, make every decision about you possible. And then you've got people really doing hard work to maintain the utility of data. I may need to know which hospital, or I may need to know location, but I've taken some serious steps to make it lower risk. Figuring out the stages of de-identification from this is really anonymous, release it publicly, to, you know what, your name's not here, it's possibly identifiable, but we've done a lot of stuff to make it unlikely, but here's all this utility. That doesn't exist well, and that's an area where we need to show those shades of gray between anonymous, less personal, and then, go ahead and do anything, it's just a statistic.
I would say, one of the simple tests is this data that you're getting or giving out going to be used to discriminate negatively against the patient? I think, that's been a fear back when it was allowable, with the insurance companies. They could discriminate because you had pre-existing conditions, and that's just one example. But, ethically, that line, I think, is an easy one to draw. If this data at some point is going out and then you're, through data brokers or some other way, it's negatively affecting that patient's care because they're being discriminated against, or affecting them in any way because they're being discriminated against, that should never happen. That's a easy, red line.
So this is a hot topic. There must be questions or comments from the audience. Bring it on, come on.
Hi, my question is it possible that by having sector-specific limitations, for in this instance in healthcare, that we are ceding the entire field to companies that have no ethos around privacy with health information? And I'll just give as illustrations. If I had access from Verizon about GPS data, from a credit bureau about purchase data, from a social media company about web browsing and search, I could likely deduce the type of information that you're working so hard to protect in a medical record without ever dealing with the HIPAA entity or violating any of these rules. So is it possible we're inadvertently allowing this market to go in the Wild West part where there are no regulations by precluding the companies that have the better ethos from participating?
Cora. That had your name all over it.
All right, put on the spot. I will take a crack at it. So first of all, I would say that in the Wild West is the FTC. So maybe it is hopefully not quite as wild. But I will also say that I think in that question is a very good question of what is health information in this day and age, and can you deduce things about about your health conditions from other things that are going on. So if I spend a lot of time internet shopping, does that mean I'm at higher risk for a heart condition or something like that? There have certainly been a number of press articles about that in the past, and that's an excellent question. I think protections in this area are important, and I think there are a number of different sort of tools, but I think the question is a good one. I don't think I guess to respond directly, I wouldn't say I think we're ceding the whole ball game, but I do think you raise a big concern.
Do we have another question?
Playing off of Jules' shades of gray and thinking about some other industries where we have really complex safety issues and security and privacy being similar to like auto safety, could we devise a mechanism that's consumer friendly that's like the 5-star safety rating? And what are the pros and cons of simplifying it to that degree?
So I guess one of the questions is, what are the challenges today with SEAL programs, right? Because at the end of the day, whether it's, anyone can do rating, right? If you started a blog and you were respected and you said, look, here's what I think about how well these things work, and here's what I think about the privacy, that's easy to do, but it's hard to get that in front of everybody, certainly the consumer reports and so forth. But the question is, can you actually, put something that is credible? In other areas, it's been a real challenge to have a real serious SEAL program, because what you really need to do is follow up, check, test, review. One company has a good product, they get 5 stars. Well, then they have another product, it doesn't look so great, but it's got the 5 stars. Foundations have never been very, very interested in supporting SEAL programs. They're expensive. There are a number of players today who offer SEAL programs, but there's not much of a margin to it, and they're constantly sort of keeping up with their worst actor. So I think, if I was sitting on the foundation world, I'd say, find some credible actors and say, you go ahead. And you know what? Don't choose just one, because people today value different things. Maybe somebody wants the lockdown experience. My wife just bought a car, and so she looked at Consumer Reports, but she also looked at YouTube, where there are these people who just buy cars and go drive them in the snow and spin them around, and probably not reliable and safe, but it was useful for her to get their wild and crazy guy view of what sort of vehicle. And so probably a multiplicity of these things need to exist, but I don't think that they develop easily in the market by themselves, because they're not very profitable. You need a lot of work, you need a lot of review. One bad actor that has your seal, and all of a sudden nobody trusts you anymore. So they're heavy overhead.
Yes, and let me just jump in and say, just following exactly on that, I think SEALs can be very useful and very effective, but they need to be robust, and there's got to be actual checking up on that. And at the FTC, we've actually brought cases against companies that offer SEALs, but they don't actually do what they say that they do. So that's a potential pitfall.
What we try to do is we say, here are the things you better promise. Now say them really publicly, because I want Cora to be able to whack you if you depart from that. So I consider her our self-regulation sort of chief.
So we have 2 minutes left, so I want to give the panelists an opportunity for a concluding remark. And so in that, in this non-HIPAA world, the greatest challenge and your projections of the future.
Yeah, so from my perspective, what I think is really interesting is as this data in healthcare begins to flow, obviously with all these privacy concerns in the forefront, what's interesting is, the difference between healthcare data and other data. I think that line's going to get very blurry, because the physicians of the future, the care providers of the future, I think all of these pieces of information tell an important part of the story. And so I think as we look at all data saying something about you, and your health is fundamentally about you as a living person in this world, I think HIPAA and what we think of as privacy and what we think of as security for this data is going to start going across sectors and across different data types more and more. So I'd say that's sort of long term. What I think is really interesting is what data is not something that tells an important part of the story about who you are.
So I would say that for me, when I look out there, a big challenge that I want companies outside of HIPAA to embrace is to really think about and build privacy and security into all of their products and services from the very beginning, and then think about it throughout the life cycle, of their product. And in the future, I agree. I think we'll see more movement of information, and the higher that bar can go, I think the better.
I know we're supposed to be talking about things outside the HIPAA realm, but what consumers really want is a comprehensive, holistic view of their health information. And again, I don't think they always track the distinctions between what information is covered by HIPAA and what is not covered by HIPAA. So for this app marketplace to really have the largest effect and be able to provide consumers with a place where they can consolidate and compile information and make it actionable and usable for them, we're going to have to first do a better job explaining what HIPAA does and doesn't allow, and just again, per the previous panel's comments, making sure that everybody, providers, patients, understand the right of individual access to health data in electronic forms, and then if consumers so choose, being able to import those and use them into apps of their choosing, and then doing a better job explaining to consumers how their data is being used and exchanged.
I think it's interesting to take a look at what's happening in just about every other sector of the world where you've got regulated autos and then Uber's breaking the rules, but the consumers want it and they're breaking the rules, and the traditional industry is saying, well, wait, how do I get involved? I live by rules. Financial tech, I'm a bank, but all kinds of financial tech is happening. Airbnb, right, regulate. Once the pipe is open, once this is technically feasible, and it sounds like we're getting to the point where it's technically feasible, there are startups who have a tolerance for risk if there's consumer demand. And guess what? They don't have to care about making money until they have everyone's data, right? So they get funded, they power their way through. If there's consumer demand for it, it will happen. And the regulated players, frankly, either struggle to figure out how to maintain their business models or how to co-opt it or live. So here it's healthcare. We can't deal with the rule breakers, really breaking rules when it comes to the impact on our lives, and we've got, serious regulatory penalties. So the sooner we can avoid what we're seeing happening in every other area of the economy where consumers are getting what they want, but with lots of stress and lots of battles and, executives being arrested and companies being sort of shut down in one city versus another city, I don't think we want that in healthcare. The gains are too good for consumers. So the sooner we can figure out those room for flexibility or those self-regulatory models, the sooner the better. Because once the pipe's open and consumers and researchers need it, the stakes are so high, people are going to be rushing through. Let's make sure that the rules are in place to accommodate the benefits of those breakthroughs.
All right, with that, we are out of time, so I'd like to thank the panelists for a great discussion.